Hello everyone, I am Jaya Bahadri from MedSurge India. Today we have an esteemed and highly accomplished neurosurgeon, Dr. Aditya Gupta. He is currently serving as a chairperson of Neurosurgery, CNS Radiology, and co-chief of CyberKnife Center at Artemis Hospital. Welcome, sir.
I'm Dr. Aditya Gupta. I am the Chief Neurosurgeon here at Artemis Hospital, Gurgaon, and I also lead the CyberKnife Radiosurgery program here. Today, we will have a discussion on some interesting parts and facets of my life as a neurosurgeon. So, I look forward to sharing my thoughts.
So, doctor, the first question is, can you share how neurosurgery has evolved over the year and how have new advanced technologies like CyberKnife enhanced neurosurgical procedures?
So, neurosurgery initially began as a life saving specialty. Patients with bleeding inside the brain, patients with head injury. So, it began as a specialty in which if we remove the clot or we remove the tumor, we can save somebody's life. But now, neurosurgery is becoming more and more life restoring and life enhancing also in some manner, in the sense that our procedures are becoming less and less invasive. We are inching towards 0% mortality or 0% complication rate in most of our procedures. So, what is happening over time is that the procedures are becoming more precise, they are becoming more tailored and focused to the need of the patient, and they are being delivered with more minimal invasion and with better care, better precision to enable almost 100% risk free outcomes.
So, the second question is, what are the most common neurological conditions you encountered and how do you approach the diagnosing and treating them?
So I think the commonest clinical situation I am called upon to treat is a patient with a brain tumor. Brain tumors is not a single disease. Tumors can happen anywhere in the head, and I'm basically called upon to solve a particular problem of a patient. For example, a patient with brain tumor can have seizures. A patient with brain tumor can have weakness of one side of the body. If they have a tumor in the pituitary gland, they could be losing the vision. So, depending on the particular clinical problem that the patient is having, we design an approach and a treatment which will sort of solve that particular problem for that patient and prevent the same problem from happening again.
So, the third question is, what are the key challenges that you face as a neurosurgeon and how do you overcome them, like both technically and emotionally?
I think that's an excellent question. See, neurosurgery is one of the most challenging medical specialties. And the technical challenge that we face is that brain tissue and spinal cord tissue is very, very delicate and sensitive. So we have to handle the normal tissue very carefully. We have to prevent damage to it. At the same time, when we are removing the tumor or the disc in the spine, for example, we have to be very, very aggressive on that part. So the challenge is to be very aggressive in removing the tumor or the disc or the offending agent and being very careful and delicate as far as handling of the normal tissue is concerned. So I think that is the technical part. Emotional part, I think what really we have to deal with every day on a day-to-day basis is we are aiming at 100% perfect outcomes for every patient. And we sometimes, because a lot of these patients are referred to us from other centers, these patients come to us with expectation of 100% success every case, day in, day out. So that creates an emotional stress on all of us as team members to always be delivering at the very top of our care every day, day in, day out, putting in long hours, sometimes on weekends, and dealing not only with the disease but also patients and families who have a lot of emotional problems and anxiety because of the disease that they are carrying.
What would you like to advise young medical students or aspiring neurosurgeons about pursuing this demanding field?
I think this is a field which demands a lot of commitment. It has a very long training period. Even after you finish the training, it takes you at least up to 5 years to refine your skills and actually to be practicing as a good neurosurgeon. So it is a field which is very technically, physically, emotionally demanding. If you have a passion for this field, then I would say this is one of the most exciting and gratifying fields to be in, because the impact you can have on a single patient's life in this specialty is practically unmatched by any other specialty. As a neurosurgeon, having a one to one impact on a patient's life, I think it is hugely gratifying to see that you can turn around the quality of life and the life of a patient, and the patient is actually maybe the breadwinner of a whole family. The patient themselves may have an active role to play socially and in other arenas of their life. So by impacting a single patient, actually you are impacting a whole group of people in a very positive fashion.